Hello there, and welcome to a very short session here to support carers who are caring for adults and for children, all about oral health and why it's important and the basic things that you can be looking for and doing. My name is Charlotte Iddon. I work for the Commission Service Community Dental Services, and we deliver oral health improvement information across the county to all sorts of healthcare professionals, non-healthcare professionals, to people working with vulnerable adults and children as well. So I'm going to share my screen. I have got a few slides. Don't worry, it's not death by PowerPoint. And then we will start thinking about oral care and how you can support your loved ones. So let's share the screen. Okay. Why is good oral health care important? So maintaining oral health is essential to overall health and well-being. Daily care can help stop problems from arising. So painful decay, infections, pain when eating, etc. can all be avoided with simple oral health care. Some people may not be able to express that they've got toothache, and those problems may get untreated. So it's important, if you are caring for someone who's living with dementia or other neurological issues, that they receive the help they need to keep their teeth and gums clean and free of debris, which obviously helps with their overall health, but also their self-esteem and avoiding any pain. I've mentioned dementia already, and I think it's really important just to highlight a couple of bits of information linked to oral care. So because of the nature of dementia, there is a decline in cognitive function, and then that's associated with behavioural changes, and these can directly affect oral health. People in the mild to late stages of dementia may develop reflexes that make toothbrushing difficult, such as closing their lips, clenching their mouth, biting, or moving their head. This does increase the rates of tooth decay and gum disease, and there's a huge increase risk of dry mouth. This is down to changes in breathing patterns and also medication and what we call polypharmacy. So taking more than one type of medication can then lead to dry mouth, and we'll talk about that a little bit later. But all of that can then lead to difficulty eating, drinking, and then increased dental pain, which may not be easy to communicate for some people. So it's really important that we're keeping a healthy mouth to avoid all these problems. Sorry, some gruesome pictures here. So a couple of pictures which may be familiar to you or may not be familiar to you. I hope they're not. But just having a look there, it's quite obvious that these two people have some oral health issues. Any ideas what other problems these could cause? So we're thinking about overall health and well-being. We tend to think of the mouth as separate to the body, but of course it is an integral part of our body that we use for all sorts of things. So unfortunately, when there's a buildup of bacteria in the area, it can lead to bigger health issues. And here are some of them. We have mentioned already dental decay. That is the rotting of the teeth, and also maybe the gum, exposed gum as well. This can lead to obviously bad breath. It can also lead to tooth loss. Another very common issue, which would have seen in those images, is gum disease. So the inflammation of the gums, because bacteria is present and not being removed, can be as mild as bleeding on brushing, but can be as extreme as mobile teeth and tooth loss as well, when it gets more to the periodontitis level. You may not realise, but if your loved one that you are caring for has diabetes, that is a two-way link between diabetes and gum disease. So people living with diabetes, if they have poor blood sugar control, they're more likely and more at risk of getting gum disease. And if they have poorer health and they have gum disease in situ, then the control of their blood sugar is going to become harder. So it's a two-way street. So keeping a really healthy mouth free of gum disease is really important for those people living with diabetes. Another really common issue is aspiration pneumonia. Perhaps not at home, but if your loved one ends up being in a more acute setting, like a hospital or a care home, long periods of time lying down and maybe not having the correct mouth care, it is possible to aspirate, breathe in some of the oral bacteria, and that can cause aspiration pneumonia. And that will make your loved one stay in hospital about a week longer. And also, it does, it's quite a tricky disease, aspiration pneumonia, especially for older, more vulnerable people. So it's something that we want to avoid and can be avoided by just brushing twice a day. There are links as well to strokes, and also there is starting to look into research linked to gum disease and things like dementia, as well as stroke, and also certain types of cancers. So it really is important to be scrupulously clean inside the mouth to avoid further health conditions. And then a couple of more things just to mention here are heart disease. So that's infective endocarditis, which is a swelling inside the heart itself, and that is directly linked to bacteria in the mouth. And then, of course, we have mouth cancer. So mouth cancer is still quite common. It's one of the cancers that's on the increase, down to lifestyle mainly. So if you are a person, or the person you're looking for after is drinking and smoking regularly, then they are way more at risk of developing mouth cancer. And the things to look out for there would be ulcers that aren't healing in 2 to 3 weeks, red and white patches that aren't healing in 2 to 3 weeks, unusual lumps and bumps that have suddenly appeared, difficulty swallowing, bad breath, dentures suddenly not fitting. All those things would be a reason to get yourself to the dentist, because they are the only healthcare professional trained to spot those early signs of mouth cancer. So well worth a visit to the dentist just for that. So what should a daily oral care routine look like? So we are thinking that we still need to continue, however old we are, whatever health conditions the person has that you're caring for, still need to be brushing if they have natural teeth twice a day for 2 minutes, once before bedtime and at one other time. That other time can be any time you choose. If first thing in the morning the person is not very compliant, then switch it to later in the morning, after lunch, in the afternoon. Really doesn't matter, as long as you're getting second brush and removing that bacteria and applying the all-important fluoride. You may need, with the person that you're caring with, to brush together. So in those routines that you're doing, your morning routine, you both brush together. So then you can prompt, observe, and help if necessary. It's important to use a pea-sized amount of toothpaste, and that toothpaste should contain no less than 1350 to 1450 parts per million of fluoride. I've given the higher amount on the screen there because obviously the more fluoride, the better protection that you get. So that would be a standard toothpaste like a Colgate or an Aquafresh. The majority of toothpaste nowadays contain that 1450. We do recommend using gentle circular movements, working along the gum line. The gum line is where the bacteria lives, so it's really important to angle the brush into there. If you're using an electric toothbrush that oscillates, makes circles, it will be doing those circular movements for you. So it's just about keeping it gentle, not pressing too hard. Always encourage the person that you're caring for to spit and not rinse. Now, this may be a new technique for them, and they've always rinsed, maybe with water or mouthwash. And if it causes a disagreement, then allow them to carry on. But where possible, if you can get them not to rinse, and yourself as well, it just means that the fluoride will stay on the teeth for at least 30 minutes so it can be absorbed by your tooth enamel and get strengthened. That's the whole reason you're brushing with a fluoride toothpaste. If you're rinsing, you're stopping it doing its job. I would suggest replacing your brush or your tooth brush head every 2 to 3 months, or at the very least when it's splayed and looks like it is worn out, then get it changed. If you notice any bleeding on brushing from the gums, this is the start of gum disease, and lots of people panic and stop brushing. That's the worst thing you can do. You need to continue to brush and really think about getting into the gum line. If you're brushing someone else's teeth, that might be easier said than done. We will look at how to brush someone's teeth in a moment. If it is not improved after 2 to 3 weeks, I would suggest seeking help from your dental professional. That may just be a phone call, doesn't necessarily have to be a trip to the dentist. Okay, so thinking about delivering mouth care to someone else, we need to decide what support is needed. I can do it myself. So this is the point where you are just giving those gentle reminders. Maybe you're brushing together to keep it in the routine and making sure that the person has got, where possible, all the necessary products needed to brush their teeth. So interdental brushes or floss, a brush and that toothpaste. Perhaps they need a little bit of support. So it's just the same, making sure that they're comfortable, that you're giving them all the resources that they need. They may need you to stay in the room or stay with them and offer any support when needed. So again, that sort of mirroring you can be really helpful here. Needing a lot of help is where you are going to be delivering the mouth care. I know the picture here is quite clinical and they're wearing gloves, but you might be doing that as well. But this is the point where you would need to get all the resources ready to brush someone's teeth. You're going to need to make sure that they're comfortable, sitting comfortably. So that's sitting up either in a chair or in bed if they're in bed, and really take your time. Be patient. And it may be that this may become, excuse me, this may become an issue where you need more than just one pair of hands to clean your loved one's teeth. So it's about making it as easy for yourself as possible. Clean the mouth in smaller sections, more frequently throughout the day if that's needed. Always explain to the person what you're doing. And also it's quite a good idea if you are experiencing some resistant behaviour from the person you're caring for, document when and which bits of the mouth you got clean, because if they are allowing you to do a little bit, you don't want to be missing any areas. So if it is becoming a bit tricky, then document it. I will show you some interesting tools that will help brushing someone else's teeth. There is also this is a very wordy slide, so please do flick back to it if you want to later on. What I will say is in the description box below this video, there is a link to another video which shows what I'm about to describe, which is someone actually brushing a person who sat in bed brushing their teeth. So that's a really good pictorial representation of how it should be done. So brushing someone else's teeth can be quite tricky, but obviously explain what you're doing and make sure that they are calm and happy with what's about to happen. You may need to, like we mentioned earlier, do some mirroring, or it may be at the point where there's some pictures around the sink to help understanding. Holding the brush, rubbing the brush on the back of their hand, tasting the toothpaste are all good ways to encourage people that this isn't something scary, it's just something that you do every day, and that they can see that the tools you're about to use are not threatening in any way. Support the person's jaw to keep their teeth together and help to clean the front of the teeth. Stand behind the person or to one side when you start brushing. You just have to find the right position for you. Encourage the person to open wide. If they find opening wide hard, then you can use a mouth rest, or alternatively, you can have a second brush and you can ask them to bite down on the second brush whilst you're using the other brush to clean the teeth. Just to mention the video that is down below in the description box, so do take a look at that when you've finished with me. Make sure you're using a toothbrush with a small head. A child's toothbrush is absolutely ideal for this. You can get them with long handles, just like adult ones, but they have a nice small head. You may consider other distractions are necessary, putting the TV on, playing some calming music. All those sorts of things can be very helpful just to distract someone if they're becoming a little bit resistant. What I would say as well, so people who are living with dementia, the mirror can become quite confusing when they're in the later stages. So standing in front of the mirror is not always ideal for some people living with dementia. And I'd also mention that some medication for treating or the symptoms of dementia do cause a burning mouth syndrome. So you want to avoid asking to brush the teeth when they've just taken their medication. So here are some of the resources that might help supporting good oral health care for natural teeth. And I'm just sort of focusing here on toothbrushes. So this one here is called a Dr. Barman's. You can see it's got 3 sets of bristles. It's what we refer to as a super toothbrush or a 3-in-1 toothbrush. And actually that brushes the whole tooth in one go. So really good for people who are resistant or even people who are still managing to brush their own teeth but have got limited mobility. They do cost a little bit more. You can buy them in lots of pharmacies. You can ask pharmacists to order them in for you, or you can buy them online. Obviously, an electric toothbrush is great if someone can tolerate an electric toothbrush. It's helpful for person brushing their own teeth, and also if you're going to brush someone else's teeth, it can be quite useful as well. I've mentioned already having a small headed toothbrush. We can also buy grips and handles for toothbrushes. This is a band. You can just use a simple elastic band if you haven't got anything like this, or if you've got cutlery holders for cutlery, you can also insert a toothbrush into there as well. What kinds of toothpaste we be looking for? So I've mentioned already, so in this image at the bottom, I've mentioned how much fluoride. Here's where you discover how much fluoride is in your toothpaste. So I would recommend that 1450 if you can get it in the toothpaste that you like. So just make sure that your fluoride is appropriate. Please do stick to that pea-sized amount. You don't need any more. It doesn't make toothbrushing any easier or better. You may decide, lots of people living with dementia or have other issues around the mouth, they may be sensitive to foaming. So you may want to find a low foaming or a no foaming toothpaste. So the Aura Nurse that you can see on the screen is no foaming. Something like a Pro Enamel toothpaste would be low foaming. And also what's great about that is not only the sensitive and the sort of sensory issue around not having any foam, but also that toothpaste won't dry the mouth. So if the person's already living with a dry mouth, avoiding an SLS toothpaste will actually help. You may find that flavour becomes an issue. So again, the Aura Nurse has got no flavour, but I will show you one in a moment that is got the right amount of fluoride, but is a fruit flavour. And often children's toothpastes are great for that. So if you have a loved one who's used to use mint and now can't tolerate it, go for a children's one. That'll be very mild mint. Go for one that says that it's 3+, and that'll have the right amount of fluoride in it, that 1450. And yeah, often they will have a fruit flavoured one. So I know like Tesco's and Sainsbury's own children's toothpaste, they make strawberry versions of them that have those the right amount of fluoride. It may be that the person that you're caring for has always used sensitive toothpaste. That's absolutely fine. Continue doing that, but make sure you're buying one that is got a good sensitivity blocker, so a Sensodyne or a Colgate. And really important not to rinse after using sensitive toothpaste, because it just won't work if you rinse. The one up in the top left-hand corner here is Durafat. This is a 2,800, as you can see, parts per million fluoride toothpaste. That would be on prescription from a dentist. Oranus is fantastic. You can get that on prescription, or you can buy it in pharmacies. So it's a really good one, or your dentist as well sometimes. The reason I've got this mouthwash up in a big picture is just to talk about mouthwash. Now, I've already said, please don't rinse after brushing. So spit out the foam, but no rinsing. This one, as you can see here, is the one that has got the antibacterial agent. It's in the glass bottle. This is not to be used really for more than 4 weeks. You can see that it's all about helping the gums, so bleeding gums, irritated gums, or mouth ulcers, but because of the antibacterial agent, not for more than 4 weeks. Otherwise, it will start to stain your teeth brown, which you don't want. Now, if the dentist has said that the person you're caring for or yourself, you are suffering with gum disease, it might be that you need to switch to the Corsadil daily and use that every day. But again, make sure you're not doing it directly after brushing. So here are 3 toothpastes. I've got Tesco's own, I've got a Senses apple toothpaste, and a Kids strawberry ice cream flavour. Would these be suitable? So I'll just give you an extra bit of information. So the Tesco's one, which is 60p, contains the right amount of fluoride. It's gone up. It was 50p. Apologies. It is 60p. I noticed the other day. And the Apple Senses one is SLS free as well, so no foaming, and it's apple flavoured, and it's got the right amount of fluoride. And like I mentioned earlier, here's the Kids Tesco strawberry ice cream one, and we've got here at 1450. So any children, any adults who have really gone off minty or have never tolerated minty, there are other options out there. So some other techniques to help support brushing would be the following. So we've got bridging. So this helps to engage the person with the task through their senses and helps them to understand what's about to happen. So that's about showing them the resources, maybe stroking the back of their hand with the brush, tasting the toothpaste. Chaining, this is where you're going to gently bring the person's hand to the mouth while describing what they need to do. So it's a physical prompt. Hand over hand is where you're placing your hand over the person's. You're going to help them gently brush their teeth. Distraction, like we've mentioned earlier, put a familiar item in their hand while you're brushing their teeth. It might be a book, it might be a photograph, but you could also obviously distract with other items like the TV, the radio, etc., or just someone talking to them. Rescuing, this is where you may, if the person is being particularly resistant to brushing, you may need to ask someone else for some help. If you are an own carer and you don't have any help, then I would suggest talking to your support network and finding out what do other people do, and just sometimes get a fresh approach or different ideas to how other people are delivering mouth care to their loved ones. So if you are caring for someone who's unable to communicate or their communication is not always clear, how would you know that they are suffering from dental pain? So facial expressions and clenching teeth, rubbing or pulling at their face, so cheek or ear is quite common. Body language, they might be huddled or rocking. They may have a sudden change in appetite and not being able to chew. They may be more restless, moaning or shouting. They may have disturbed sleep, or they may be leaving out their dentures. So all of those are signs that there is something going on in the mouth that needs to be checked. And what I would suggest is you are not dentally trained, and neither am I, but what can be really useful at this point, if possible, and certainly earlier on, is to have a pen torch and have a look inside your loved one's mouth. It's non-invasive. All you need to do is ask them to open wide, but that pen torch allows you to see inside. Imagine if the dentist was going to do some work inside your mouth without that big light. It wouldn't go well, would it? So that light, that little light source, just allows you to actually have a look and see what's going on. Is there anything that you've missed while you've been brushing the mouth? Now, lots of people will have partial dentures or full dentures. The percentages of people are quite low nowadays, but you may well be caring for someone who's wearing dentures. So I just wanted to touch on it really. So dentures should be cleaned the same as teeth, so twice a day. Obviously, you might be cleaning the person's dentures for them, and the risk really here is with denture stomasis, which is rather like a thrush. We do suggest using a soft bristled toothbrush to clean the soft tissues and the gums while the dentures are out and perhaps soaking, which we'll come to in a second. Then it's a good idea to encourage the person to brush their own soft tissues, their gum lines, etc., or you to do it with a separate brush and perhaps some toothpaste if they'll tolerate it. Really encourage people to be cleaning their teeth and gums if they've certainly got a bridge before they go to bed. So it's the same situation as with natural teeth. Before bed's really important, and one at a time. Perhaps speak to a dentist about getting a second set of dentures and having the person's initials or name added, as you can see in the picture here. Sometimes quite helpful to have two sets of dentures. Obviously, there's a price associated with that. If you're on the NHS, it would be band 3. Also, just to mention that some people further into their dementia journey may stop wanting to wear their dentures altogether, but the mouth still needs to be cleaned with a toothbrush and paste if they can tolerate it. And where possible, if a person can leave out their dentures at night, that's what we recommend. And we would certainly say that dry is better than anything else. So in a pot with a name on it and dry once clean. So how do we clean the dentures? So removing them obviously is really important. Someone might need help to release their dentures. Brushing them over a bowl of water or over a towel in case you drop them. Use a different brush or a denture brush to clean the dentures. We recommend a denture cleaning paste or unperfumed liquid soap. Toothpaste is not suitable because it's quite abrasive. Once cleaned, rinse them under cold running water. And here comes the point where you're going to use a denture cleaning solution. So something like Sterident or a supermarket own one. Now, lots of people Assume that these Sterodent tablets are just like they were 10, 20 years ago and put them in a pot and leave them overnight. They are much more clever than they used to be, and they actually only take 3 minutes to do the job. So what we would say is put them in the denture cleaning pot with the tablet, let them fizz away. You perhaps don't need to do this every day, or if you're going to do it every day, you might just decide to use half a tablet to make them last a little bit longer. They will disinfect the dentures better than just brushing alone, but it literally take 3 minutes. So whilst that's happening, that's the time then the person or you will clean the soft tissues and the gums using a baby brush or a children's toothbrush or an adult brush if they're absolutely fine, and toothpaste if they'll tolerate it. And I would say at this point, use your torch to have a good look inside and make sure that there's nothing untoward going on, no rubs, no sort of ulcers or anything from the dentures. Remove the teeth, the dentures from the solution and rinse them well. Now they can be returned back to be worn overnight. If possible, encourage your loved one to sleep without their dentures and store the denture in a clean name pot in plain water or dry. So if they're stored dry, this will avoid thrush and it will also avoid anyone drinking the solution by accident. We also say if you've got a partial denture or a denture with metal, then you need to use a slightly different cleaning solution, and just really pay attention to any clasps and make sure they're cleaned. Always check your dentures for cracks or damage. Just want to highlight here that these yellow, sort of pink swabs, which you may or may not have seen before, they're often used for palliative care, are sometimes misused for mouth care. Now, these are ideal for getting water into someone's mouth, but they are used once only, and they actually have a medical device alert on them because it actually caused choking. So what we would suggest is to choose something like this. It's called a mouth ease. And so it's really important that if you are doing palliative care, that you're not using these pink sponge swabs. So food obviously has an impact on the mouth, but also food is important to us, isn't it? Really important to us, and we enjoy it. So it's really having a holistic approach and really consider, what does the person like to eat? Have they got any medical conditions, which means that they shouldn't be eating lots of fat or lots of sugar? Is there been any advice from a dietitian or other professionals around what they should eat? You know, if they've got a swallowing issue, should it need to be thickened, etc. Dehydration is obviously something that we want to avoid, along with malnutrition. So making sure that they are taking on lots of fluids, and then really their overall nutrition levels. It may be if they are on things like like a protein or a shake. Can't think of the word, apologies. You know what I mean. I'm sure that those are often full of sugar and obviously will have an impact on the mouth. So you may consider then talking to the dental professionals around having that high fluoride toothpaste prescribed for your loved one. Obviously, we know that sugar can cause tooth decay, and if it's eaten frequently between meals, you are putting yourself more at risk of tooth decay. So very quickly here, we're just going to look at what would be a tooth-friendly snack to have in between meals. Now, obviously, this will depend on how well the person is chewing and swallowing, but things like fresh vegetables and fresh fruit, you can see in the picture there, any bread with sugar-free spreads, savoury crackers and cheese, pita bread with hummus or guacamole, rice cakes, oat cakes, and plain yogurt. And really, what we're thinking is in between meals, where possible, try and stick to sugar-free drinks as well, like water, tea, and coffee, as long as they're without sugar and using plain milk. So in an ideal world, what we're saying is any biscuits and cakes and pastries and things like that you'd have as part of a meal, so as your pudding or part of your breakfast. And that will just then protect your teeth. So thinking about going to the dentist. Now, this obviously is quite tricky at the moment. We know that 91% of NHS dentists are not taking on any new patients. So hopefully if you've got a dentist, then please do use them. It is recommended to have checkups usually, and it's a big difference. So 3 to 6 months for people with their natural teeth, and that might go up to 12 months if there's no issues. And then once every 2 years for people that are wearing full dentures. Obviously, you can visit your dentist before that if you have any problems. You may need to discuss with the dental teams, especially if you're caring for someone who's got a physical disability or is living with neurological problems like dementia. You may need to talk to the dentist first and agree on the best treatment plan for that person. So what's their level of independence? Will they cooperate? How are their thinking abilities? What's their mental state? Any physical impairments going to stop them accessing the dentist? What dental symptoms, if any, or problems the person is currently experiencing, and whether the person is able to give informed consent for any treatment. So that's quite important, and that is just a conversation with your dental team. So they are good at that. They know what a plan is, and they will work with you to get the best treatment for your loved one. Obviously, that capacity to consent is quite important. So prior to any assessment, consent needs to be gained from the patient. All adults are presumed to have sufficient capacity to decide on their own treatment unless there is significant evidence to suggest otherwise. If a patient declines mouth care, it does not mean they have a lack of capacity as long as they understand the consequences of their decision. So this is something you're going to have to work with the dental team to decide around capacity to consent. If they lack the capacity, a decision whether to go ahead with oral hygiene will need to be made by the health professionals treating them. So that will be the dentist and the dental professionals. In order to make a decision, the person's best interests must be considered in line with the Mental Capacity Act of 2005. So it isn't a case of get them in there and the dentist will do everything. It does need to be in line with that capacity to consent. Now, as I've mentioned earlier, when you get to the dentist, that is where they're going to be screening you for mouth cancer. They may not tell you that they're doing it, but they will be looking inside your mouth, your loved one's mouth, for any early signs. So the dentist, like I said, is the only one trained. Mouth cancer rates are low, but they are increasing. It is more likely in men over the age of 65, and the biggest risk factors are smoking and drinking alcohol, whether you're a current smoker and drinker or whether you were one historically. The other thing that you can do if getting to the dentist is not possible is to check your own mouth or check your loved one's mouth with that light source, checking for any lumps, bumps, slow to heal ulcers or red and white patches. If you could do that once a month, that would be really good. And I have finished. So hopefully, I just want to say thank you for spending your 30 minutes with me thinking about oral health for your loved ones. Hopefully it's been useful. Like I mentioned before, there is in the description box, there is a link to a video, like I mentioned before, actually physically seeing someone brushing someone else's teeth in a hospital setting. And then also there's a link to our website, which has got all sorts of information around oral health. Thanks for coming and thanks for listening. Take care. Bye-bye.